preferred sedative agent for post-intubation sedation, propofol or midazolam in the setting of seizures? Thanks for the question at rmahan003. I'll briefly touch up on induction agents here. It's important to note that Etomidate does not have anticonvulsant properties. It does bind to the GABA receptor, but to a different subunit than our typical GABAergic meds we use for anti-seizure properties, such as benzodiazepines and propofol. With that in mind, I'm a huge fan of using propofol as my induction agent and transitioning to this for post-intubation sedation for this patient population. It's got great kinetics, rapid onset, and short duration of action. The induction dose is similar to the dose you would use for terminating seizures, so use it as a twofer and address the underlying problem if the hemodynamics can tolerate. The limiting factor is hypotension, which can be fluid responsive, but with its short duration of action, you can just shut off the drip. On the flip side, with midazolam, yes, it has anticonvulsant properties at 10 milligrams, but if you're going to use it for induction, you have to use a much larger dose. The dosing range is 0.2 milligrams per kilogram to 0.4 milligrams per kilogram, and there is no max dose. So with these much higher doses, you lose out on its cardiovascular neutral properties and can induce hypotension, which can be problematic since it has got a longer duration of action, and that's going to get you in trouble. So most times, propofol is going to be the best choice. You can up-titrate rapidly to as high as the patient's hemodynamics can tolerate, or to burst suppression if you're hooked up to an EEG. And oftentimes, midazolam is considered more of an adjunctive post-intubation sedative. And there's always the risk of benzodiazepine-induced delirium with accumulating doses in longer therapies. I appreciate when you guys drop your questions. Make sure to drop them below in the comments or shoot me a DM, and I hope you learned something new.